Good afternoon, everyone. Thank you for being with us today. I want to start by saying thank you to Dr. McDonald for graciously covering yesterday. I am so grateful for an amazing team of people. There are scores of people that work tremendously hard and have been day after day through all of this that you all don't get to see, but can certainly know that they are there and that I am grateful for them, as is the governor and Director Smiley. I'll start off with our numbers for the day. As the governor said, we have 122 new cases to report. We also have 219 people currently hospitalized. Of these 219 patients, 47 people are currently in the intensive care unit and 33 are on ventilators. Sadly, we have 16 new COVID-19 associated fatalities to report. These people ranged in age from their 50s to their 90s. 2 people were in their 50s. 1 person was in their 60s. 6 people were in their 70s. 5 people were in their 80s. And 2 people were in their 90s. Our sympathies and prayers are with the families of these treasured Rhode Islanders. I know that the governor and Dr. McDonald talked a little about nursing homes yesterday and again today, so I wanted to follow up briefly with a few additional words on that topic. As most people know, we have been doing cyclical testing in nursing home settings. We've talked about that before and wanted to bring back an update on where we are in that process. What cyclical testing means is that we have been offering tests to all residents and staff at all nursing homes across the state. That's roughly 7,500 people in 85 nursing homes getting regularly tested. We have completed the first 2 rounds of this cyclical testing at all nursing homes throughout Rhode Island, and we are well into the 3rd round of that testing with roughly 20 homes already having testing offered. We are including residents and staff with each round as we're offering the tests. This is a critical and tremendous accomplishment. I'm sure far exceeds what is going on across the nation. We could not do it without the great appreciation of General Callahan and all the members of the Rhode Island National Guard, as well as the entire team across state government that has been directly involved in helping to do this. We also very much appreciate the staff and administrators at the nursing home facilities throughout the state for their partnership and support to allow this to happen. This is the focus of how we want to continue to go forward aggressively, really honing in on the places that have the highest risk of transmission. We will be expanding this to our other congregate care settings as well. We've already started that process, particularly where there are clusters of cases, and want to continue to aggressively maintain this type of testing in a regular format. Every fatality associated with a long-term care facility that we have to announce is incredibly saddening. It adds to why the governor had shared in the past. We refer to it as a mission when we are going out into nursing homes to offer support, to provide testing, to give guidance with infection control practices, to make sure that they have the PPE that's needed, because we know what is involved with the staff and the residents who are there. One thing that is helpful to share as we're continuing to look at the data is the encouraging direction we are going in terms of our cases in these facilities. We report online on the number of cumulative cases at nursing home facilities, as well as the number of new cases, which we define as new cases over the last 2 weeks. Between last week and this week, our number of new resident COVID-19 cases in long-term care facilities decreased from roughly 575 to roughly 370. And that is with the increased, aggressive, ongoing testing that I've shared. This is encouraging in terms of our ability to start to see progress. It aligns with what the governor said of really being careful and thoughtful going forward through phase 2 and being hopeful about what can happen in phase 3. There is so much more work to do, and we want to make sure that we continue this progress as deliberately and aggressively as we can. Testing residents in nursing homes and other higher risk settings is one very pinpointed and targeted approach to overcoming and crushing COVID-19. We want to also be able to, at the community level, focus on testing people who have symptoms, because that remains the core of our approach from a testing standpoint. We want to also be able to spread from there those who have symptoms and get tested, those who they have been exposed to as contacts. We want to continue to be as targeted as we can be to rapidly respond to results, help people in getting isolated and getting their contacts quarantined so that we can continue to move forward and see the progress that's needed, making it a safe way for us to reopen the economy in Rhode Island. Testing people who have symptoms quickly means that we can implement all of the steps that we need to, the contact tracing, getting people's contacts into quarantine, and it really allows me to emphasize the importance of downloading the Crush COVID app. The more people we have involved, aiming for the 50,000 that the governor shared, the better we will be able to get our hands around COVID-19 and continue to stay in front of it. Please know, if you have symptoms, we need you to be tested. We've worked hard to make sure that the capacity is available throughout the state. With each week, more and more testing sites are opening, and we are working to get more of them in the communities that are being hit the hardest. The capacity is there. It's now being able to encourage people that this is what needs to happen. If you have symptoms, we are here to help get you tested and get you the support that's needed. We have information about testing and COVID-19 generally online in many different languages. So please go to health.ri.gov/COVID.